Okay, today we're talking about ostomies and ostomy care. What is an ostomy? An ostomy is an opening in the abdomen. Here's an example on this model we have. This is an ileostomy and a colostomy. It depends where we're talking about in the abdomen, but basically what we're talking about is the intestine comes out, gets folded over and stitched around. Why would someone have one of these? Well, perhaps because they've had cancer of the colon, perhaps they've had diverticulitis or Crohn's disease and there's been a lot of damage to the colon. Whatever the reason, they've had to go in and surgically remove part of that colon, and then therefore they bring the colon out through the surface of the abdomen, turn it around and stitch it back down around. And you can see this is what you have. This is an ostomy. When it's in the colon, it's a colonostomy. And when it's here, it would be an ileostomy. That would be where it happened in the ileum, the last part of the small intestine. Okay. So obviously there has to be a covering and then a device to hold the feces as it comes out. This is how they would have their bowel movements. Depending on what part of the colon was removed is what you're going to see as far as the fecal matter. If they have a great deal of the bowel removed, possibly in the ascending colon, the fecal matter is going to be rather loose, and it's going to get less loose, more formed as it goes through the transverse colon and then finally into the descending colon. Okay? Now, so there's different types of devices. This one is called an all-in-one. You can see the wafer and the bag are in one piece. Now, you can see this hole is not near big enough. You can see how there are different lines here. So you would measure, and then cut the opening. The key is you only want to cut it to where it's just covering this. You do not want it way out here where a lot of the skin is open to the fecal matter. This will cause the skin to break down. You don't want it too small where it's not going to fit over the ostomy. It needs to just fit around it nicely, and that takes some measuring. So then you would cut this and then seal it over here. This has a peel off layer, as you can see here. And this peels off, revealing the sticky part. This is put on the skin and then rubbed. You have to really push to get it to form in well, to form a good seal. There are some products that you can put on the skin to help this. One thing I'm going to tell you is that if you use regular wet wipes, they have lanolin or some kind of a moisturizer in there. It'll make it so that that wafer, they're called a wafer, the sticky part, won't stick. So you want to be careful of that. Then they have a two-piece. And in the two-piece, you're going to have the wafer separately. Now, in the two-piece, the wafer will stay on for many days, sometimes a week. Medicare will only pay for so many a month. So you have to be very careful not to misuse them. You want to get them on and settled and on there very well, and then take care of it, so you don't have to use more than they're going to pay for. It's a really bad day when you run out of them before the end of the month where you can get new ones. Okay, so this would be a pre-measured one where the opening is the size that is ordered for the ostomy. This would fit over nicely here, I think you would agree. And then we would peel that off and really make that fit nicely over that. You can see it almost has like a Tupperware type seal on it. And the bag will seal right to it. Okay, and you can take the bag off and replace the bag as prescribed. Now, some bags are meant to empty and reuse. Sometimes Medicaid or Medicare will pay for only one bag a day or one bag every 3 days. You need to be aware of that so that you know you're not going to be using more than you have the ability to have for that patient. Many different sizes, many different brands, different styles. Each resident will have their own, and they are not, you can't use one style for another resident. They're all very individual for the size and the type of ostomy they have. Okay, here's an example of an all-in-one. And then this is an example of a two-piece. Okay. You have to be, again, very careful on the size that you cut it out for us to make sure it fits very nicely so you don't have extra skin exposed because it'll get raw and you could end up with a bad skin ulcer. Okay, I hope that helped.